Here at the Melanin Initiative, we simplify medical information into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective. Today, we'll be talking about the Florida Atlantic Dermatology Nurse Practitioner Certification Program, how this program bridges the gaps in NP dermatology education, clinical, professional, and leadership skills for NPs, and how NPs can leverage advanced training to advance patient care and career growth with our special guest, Dr. Patricia Delgado, a doctorally prepared nurse practitioner and the new head of faculty for the program. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, another doctorally prepared nurse practitioner and one of your co-hosts here, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. We have two missions here. The first, to promote that health literacy, both amongst the publics and our colleagues in medicine. The second is to elevate the expertise of nurses. There's 5 million of us, but a lot of not of people know what we do. And even within nursing, we don't always know all that we can do. We like to bring awareness to all the diverse career opportunities in the industry and to let all of our clinician friends know all the different ways they can leverage their expertise, both as clinicians taking care of patients, but also as entrepreneurs. If you're new here, welcome. This is your chance to subscribe. Leave a comment or two, thumbs up the video, go over to Apple and Spotify and do the same thing. Every time you interact with our platform like that, it shows the algorithm that this information is important, so that when people like you look for topics like this, we'll show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you think you might be having a medical emergency, you seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you should call 911. If you or someone you know might be having a mental health emergency, you can call 988 or text 741 741. Dr. Patricia Delgado is a Nicaraguan American nurse practitioner based in St. Petersburg, Florida, with over 11 years of experience of nursing, 8 years as a dermatology nurse practitioner. She holds a Doctor of Nursing practice degree and is board certified, triple board certified in adult gerontology primary care, dermatology, and psychiatric mental health nursing. Dr. Delgado's career began with a passion for veterinary medicine, but after exploring various academic paths, she found her calling in nursing. She worked in critical care for 5 years and has specialized in medical, surgical, and aesthetic dermatology and psychiatric research, contributing to publications and advocating for patients and APPs, or advanced practice providers like NPs and PAs. As the founder of Sunrise Skin and Wellness, she offers a holistic approach to dermatologic care, emphasizing patient education and individualized treatment plans. She is also the head faculty for the Florida Atlantic University Dermatology Nurse Practitioner Certification Program, where she mentors the next generation of dermatology nurse practitioners. She is passionate about community service and education. She previously served as the president of the Florida chapter of the Dermatology Nurses Association and volunteers as a team leader with the PET Partners. She is also an adjunct professor and DNP advisor at the University of Central Florida College of Nursing. Dr. Patricia Delgado, welcome to the Melanin Initiative.
Thank you so much, Dr. Madison. Thank you for having me here.
Yes, a woman of very, very, very many hats. We only touch on a couple of them. So we thank you for spending some of your valuable time with us so that we can bring attention and awareness to those NPs looking for ways to make their transition into dermatology. Before we begin our interview, we like to get to know you a little bit better during our icebreaker. This is a very relaxed part of the show. 5 questions, 5 minutes. Don't overthink it.
Sounds good.
Okay, the first one, what do you value now that you didn't 10 or even 20 years ago?
I value, let's see, 10 or 15 years ago, where was I? 29. I value my time at home a lot more. I value, I'm trying to think what I was doing back then. Yeah, just spending time at home with my family and quiet time more than I did 10 years ago, 15 years ago.
Mhm. And who makes up your family?
My close family is my husband, my partner, and my puppy dog. And then my greater family unit is my parents, who now live only 7 minutes away, which is wonderful. 10, 15 years ago, I was in Orlando and they were in North Tampa. And now one of my brothers also lives in St. Petersburg, Florida. So that's really wonderful because I think back then he was in Phoenix, Arizona.
Hmm.
So we try to make time to all be together. And my other brother is in New York City, but we watch him on TV once a month, and he tries to get down here a few times a year to see us and also to do comedy shows.
The great Tim Delgado, comedian, lawyer, extraordinaire.
Yes, yes. You
shout,
know Tom. Yep, Tom DNYC. Yeah,
shout out to him.
yeah.
What's the next big idea you want to be a part of?
So the next big idea or the next big movement.
Hmm.
Is it okay if I segue or
Yeah.
to that? So the next big movement that I want to be a part of is exploring the different ways that psychedelic medicine can help patients to process and overcome trauma,
Hmm.
which will then help with their physical illness and their physical issues and concerns, including our skin. So we know that our mind is very much connected to our skin, and unprocessed trauma can reflect in autoimmune skin disease as well. And I
Wow.
want to help to uncover that.
All right. I love that one. And already I have ideas in my head for other shows and collaborative conversations. What's the most important thing you've learned about communication?
Over the years, the most important thing I've learned is to be quiet and listen, and just how important and significant that is.
Yes, our greatest clinical skill. And I bet in your line of work as a psychiatric mental health nurse practitioner, even more so, helps create that space for your clients too.
Yep. And approaching with curiosity
Mhm.
rather than judgment.
What's the most important investment you've made as an entrepreneur?
Education, education and coaching and books.
Okay, so now two things. One, favorite book, and two, can you describe coaching for those who might not be familiar with it?
Favorite book. So I always have different favorite books, but right now, a really one that has really impacted me most recently is The Myth of Normal by Gabor Mate. And um, describe coaching.
Oh, well, tell us a little bit about just like a sentence
Oh,
or two about that book. You said it's
so
impact.
I mean, I
Left
actually
us hanging, Patricia.
I have it right here actually,
Yeah.
just because I have so many ideas of things that I want to write about. There's so much in this book, but basically,
Show the
Gab.
cover.
uh, so yeah, and actually the subtitle is really important too because it's trauma, illness, and healing in a toxic culture.
Hmm.
So it basically talks about how we all experience trauma in different ways and we carry it within us even before we're able to speak. We're still taking in information. Even in the womb we can experience trauma that can manifest later on in our physical and our mental health. And then it talks about how our culture is kind of designed to really make it worse and feed into it. But then, of course, at the end, he does go into what we can do as people for each other, for ourselves, to help overcome that and build bridges with each other. So it's a really powerful book.
Thank you for sharing. And
Mhm.
the last question, my favorite one, what season are you in now?
What season am I? So I am in my 40th year. So I'm 39. I'm in my 40th year. So when I turned 39, I was like, I'm gonna go big and do all these things. And so I think just recently I've like turned this corner where I'm like, I should probably back up a little bit. So I think in this season I'm going to be realigning, refocusing on certain goals and getting back to being at home a little more and not trying to save the world.
Hmm. I like that. Thank you so much for sharing and allowing us to see a different side of Patricia than we normally get to see in some of these interviews. She's all over the internet. You can just Google her. So, as I described before in our brainstorming, we have a case study. And I'll go through the case study, and throughout our conversation, we'll give advice to Jordan. And we just hope through our storytelling that our audience is able to find this a little bit more relatable. And it reminds us to make sure that we don't get caught up in talking to one another and that we have other people in this conversation with us.
Mhm.
So, Jordan is a 34-year-old nurse practitioner living in Florida. He has 5 years of primary care experience, but's limited dermatology exposure. He's motivated to expand his skills for his clinic, which serves a diverse urban population with a high prevalence of skin disorders. He encounters patients with complex dermatologic conditions like acne, psoriasis, melanoma risk, and feels underprepared for advanced management and procedural skills. He wants hands on dermoscopy training to learn dermatopathology, how to collaborate with dermatopathologists, understand billing and coding and practice management, and to strengthen his clinical decision making skills, especially when it comes to dermatology. As far as where he gets his information from, he's followed a lot of dermatology NPs on social media and online professional forums. He's attended some webinars and observed mentors, but he really wants a structured postgraduate training program to consolidate the knowledge and network with his peers. So, for our first question, can you tell us the name of the program, when it started, and who are the key people behind the creation?
So the program is at Florida Atlantic University, the Christine E. Lynn College of Nursing, and it's technically the postgraduate dermatology nurse practitioner certificate program. And it started in 2021 was the first cohort, and I believe Mary Nolan and Dr. Margaret Babanich were starting to work on it back in 2018. So they poured a lot of sweat and tears and heart into this program to build the foundation. They're both incredible women, and they had it until about 2022, and then someone else took over. And most recently, that person had to leave for medical leave, and so I stepped in, and Mary Nolan came back.
Can you give us just a little sentence or two about Mary Nolan and Dr. Rabanich's
Yes.
contributions when it comes to
Oh,
dermatology nursing education?
absolutely. So I'll start with Dr. Margaret Babanich just because she's one of the founders and she's no longer in the program, but she's just an amazing individual. She's one of my mentors, and she started this program with Mary to help prepare nurse practitioners that wanted to get a stronger base in dermatology so that they would segue easier and better and more fluid into dermatology practices in the area. And she also founded the CDNPPA now. Now it includes PAs. So it's the Center for Dermatology Nurse Practitioners and PAs. It prepares nurse practitioners and PAs for their respective certification exams. So for nurse practitioners, it's the DCNP certification exam, the Dermatology Certified Nurse Practitioner. And for PAs, forgive me, I don't remember what it's called, but PAs now have a dermatology certification as well. So, which is wonderful to get your certification because it's basically showing future employers, showing your patients that you have a good foundation in dermatology knowledge and skills, and that you're passionate about professional growth and maintaining a good standard of care for your patients. Mary Nolan is a nurse practitioner and has been a dermatology nurse practitioner for many, many years. She is extremely knowledgeable and amazing, and she's known Dr. Babanich for many, many years, and they're best buddies. And actually, she's going to go visit Dr. Babanich in Australia in October. So yeah, because Dr. Babanich is teaching Australian nurse practitioners dermatology. And anyways, Mary Nolan is my partner in the program. She is integral to assisting me with parts of Canvas and kind of the structuring of the program. Since she's the one that built the foundation, she's been extremely, extremely helpful. And Dr. Susan Bolfin is the director also of kind of the overseeing the whole program. So she helps with making sure that we're communicating with Veronica, who does the behind the scenes Canvas work, or the IT, I guess you'd say. And then Joe Lotito, he's been helping with the admissions process, renting the rooms for the workshops. And yeah, it's just a fantastic team. And then I'll mention Lynn Palma. So she also works at FAU, but she works for I believe the DNP program and the Family NP program. But she had wanted to sort of sit through last year's cohort with us and learn, but also she was integral to helping us with strategies for creating the quiz questions in such a way where they can be moved easily or reworded easily, creating the exams and like a good flow of the online structure. So she was absolutely wonderful as well. We have a great team.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
Oh, wonderful. Shout out to him and thank you. And shout out to Joe because he made sure my email got where I needed to go.
Yes. Yeah, he's good at that.
When it comes to the program, for our audience who might not be familiar, what gap in particular is the program addressing when it comes to nurse practitioner education?
So that is a great question. And I personally feel that the nurse practitioner programs in general, the master's programs, whether it's adult gerontology, acute care, or family, they're very general and you learn a lot. And I'll just use my program as an example. So I was adult gerontology. You learn a little bit of cardiology, a little bit of gastroenterology, a little bit of women's health, a little bit of dermatology. They definitely prepare you for the board certification and for, just very general care in those specialties, but they definitely do not dive into the details of the specialty. So with dermatology, I'll never forget. I just have it in my head of psoriasis. It's the silvery scales on an erythematous base. And I don't think we really got any further than that, or if we did, it wasn't much further. So this program helps bridge the gap between what we learn in our initial nurse practitioner certification and what we will see when we start actually working in the specialty of dermatology. Because, in primary care, you'll see it all as well, but you'll be limited with how much you can treat because you were limited in what you were taught in school and what you saw in school.
Thank you. Yes, every great program has a mission and vision. What drives FAU's dermatology certification program and your team's goals?
So I would say it does relate back to filling that gap in education, but also specifically with FAU, their philosophy and their principles are centered around caring for the whole person. And that's actually another reason why I love working in this program, because I'm a big believer in, how we feel emotionally, how we feel mentally. It's connected to our skin and how motivated we are going to be to take action, to take the medication, to use the ointment or whatever it might be. So yes, we definitely lean heavily on taking care of the whole person. And so with our dermatology program, we always incorporate in our lectures how to talk to the patient, what questions to ask about their situation, about their family life, their community, how it's affecting them socially, and in other ways in their life. And yeah, it's a very diverse program, so I really appreciate that as well.
Can you share your role, how you became involved in the leadership dynamic between you, Mary, and Dr. Sue Bolfin?
Yeah, so I received an email from Dr. Bowie, who I think is a little higher up within the College of Nursing, and she asked if I was available and open to possibly taking over the dermatology postgraduate program at FAU. And I was like, oh, well, this is a very interesting opportunity. And as I mentioned earlier, Dr. Margaret Babanich is one of my mentors. So I called her and just got her opinion because I think at the time, I think my practice was like a year and a half old. And as a fellow entrepreneur, you know that being an entrepreneur it's a lot. So I wanted to make sure it was something that I could handle. And I feel like either Dr. Bowie or possibly Dr. Babanich mentioned that, or actually Dr. Bolfin, when I spoke with her, she said, if you want, you can have someone, if you know someone that you think could help you, and, you're welcome to find someone else to assist you. And, you'll both be on the faculty. And so I thought, oh, that's wonderful. When I talked to Dr. Babanich, she said, you should talk to Mary Nolan because I bet she'd come back and she'd be happy to help. And so she was, and she did come back. And so, yeah, now we are a power team.
We love that. Did you pull Mary from retirement, or she just was no longer in academia?
Basically from retirement.
Oh, okay.
But she's loving it though. Don't worry. She's
I,
having it.
yes, nurses are always going to say yes. And actually, well, before we wrap this up and I forget, because you were talking about all the accolades of Dr. Babanich, also
Mhm.
one of the co-founders of the Journal of Dermatology in Peace.
Yes. Thank you for reminding me. Yes. And that is so, yeah, amazing.
Which,
Thank you.
as far as I know, the mission is really to assist those transitioning, really new to derm, to help make that transition a lot less overwhelming.
Mhm.
Yeah, both of us huge advocates of research, so of course we support publications like that, so our
Yes.
colleagues can stay up to date and provide the best and safest care for our patients.
Mhm.
Since the start, and it's okay if you don't know, do you happen to know how many providers have participated, and do you continue to see a growing need in dermatology NP training?
So 21, 22. About 100 to 120 because the each cohort is about 20 to 25 students.
Mhm.
And what was your second question? I'm sorry.
Do you continue to see an increase in the request for NP training when it comes to dermatology?
Yes. So this year we actually had to make a decision as far as where we cut off the admissions because with it just being Mary and we want to uphold the caliber of the program. So it's an online program. However, the classes are live. We do Q&A. We do assign case studies that Mary and I will pour over and write comments. And so the larger the class size, the less we're able to give that one-to-one attention. So we do limit it specifically to about 25, or we'll admit 30, or I want to say we admit 25. No, sorry, I said that wrong. It is 30. And then a lot of times things come up. So a person, they'll get accepted, but they just won't pay. It just won't work out for them for whatever reason. So then we end up at 25.
And that kind of resembles residencies, right? Whereas you want to keep it kind of intimate and small so people can get that
Exactly.
high caliber training. Yeah. When we start to think about like long-term vision of a program, we have to also think about the quality of that education.
Yes. Hmm. And they mentioned hiring another faculty member, but and Mary and we were in agreement with this. Like, we want to build a good foundation because she and I have just started working together 2 semesters ago. And so we want to make sure, and this is our final semester that we haven't worked together. And then once we finish this next semester in the fall, that'll be, we'll be complete. Like, we've done 3 semesters together, successful cohorts, and then maybe we can start talking about and looking for, and like interviewing but not really interviewing. You meet people at conferences or you talk to your colleague and fill them out. Are you interested in academia? And see about possibly bringing someone else in.
Hmm. Yeah, I
Mhm.
think you're going to get those emails after this show airs. It might be it might be the end of the three
Mhm. Yeah.
semesters. But
And honestly, we're open to that.
yeah.
I love talking to people. I'm a big fan of networking.
Hmm.
So, even if this opportunity doesn't happen, it's wonderful. I'm just saying this to everybody. Just talk to people, make yourself known to everyone in academia because you never know when down the road something else might come up. And then they'll be like, "Oh yeah, I remember this person," and they even live in the same state. So it's always good to just reach out to people. And I say that now, but when I get 100 emails 6 months from now, I'll be like, "Ah."
Mhm. Yes, and thank you for that little piece of advice too that you tacked on there. Very, very important, because otherwise you wouldn't just have an email pop up in your inbox one day asking if you're available to be head of faculty.
Mhm.
What should prospective students know about program requirements, length, costs? We'll start there.
So the program is 3 semesters long, and starting with us, it is fall, spring, and summer. So fall is the essentials of dermatology. So building a good foundation, we do a little bit on morphology and microbiology, immunology, and then the second half of the semester. And then we do have a skills workshop in the first semester. So basic hands-on skills, suturing, punch biopsies, shave biopsies. I think we're doing a little bit of dermoscopy in the first skills workshop, and so that's the first semester. Second semester is the spring semester, which there's no skills workshop, and that's just basically dermatology 1. So we dive a little deeper into different topics. And the third semester is in the summer, and there will be the final skills workshop then. These semesters are $4,000 per semester, and you basically pay per semester as well. And each semester will give each student 40 continuing education units.
Wow.
So even if you only do the one semester and you decide, oh, I don't think I can continue, at least you have your 40 CEs. We no longer require the clinical hours. However, it's highly recommended, just so that you can expose yourself to some of the things that we're talking about and some of the things that we're writing about. And hours per week, I'd say maybe 10 to 15 hours per week. It depends. Most of the students that we get are not working in dermatology, but if you're already working in dermatology, or you kind of have a good, you're exposed to it to some degree, then maybe it won't require so many hours. So it just depends.
And on those requirements, are there any certain level of experience or certain degrees prior to?
So there's no certain level of experience. However, we only accept family nurse practitioner, pediatric, women's health, women's health NP, acute care, adult, and adult gerontology.
Okay.
So, yep. And, hopefully the person's working in a setting where they can be exposed to it. Yeah.
Okay. And the faculty, is it just you and Mary?
Yes. Mhm.
Okay. And
Oh, sorry. So it is just us as far as the faculty that are with FAU.
Mhm.
However, for the presentations, we do bring in guest speakers quite often.
Oh,
So, for example, we have Dr. Babanich come and speak on bullous diseases, and she's also going to be doing the microbiology presentation. And we're going to be having Dr. Gisela Torres doing a couple of presentations as well. And we have different nurse practitioners that we have in our network and PAs that are experts with the different disease states. And so we'll bring them in to talk and connect with our students as well.
oh, lovely. And these presentations, these are online sessions?
So the presentations are over Zoom and they are recorded. However, we basically require students to be present, not necessarily for the cameras to be on, because we understand life. You got to cook dinner sometimes and be listening. But if we have a guest speaker, we encourage cameras to be on. But anyways, your students are encouraged to be live in the classes. However, for example, we have one student who just got admitted. The first class is Wednesday and she can't be there. So we do record each one just in case someone isn't able to make it, and so they can watch it later.
And so you brought up a good point. So when someone gets accepted, is it like rolling admission or it's only open a certain time during the year?
It's only open a certain time during the year.
Okay. And what are the requirements for that? Do you have to have like recommendation letters or send in transcripts?
So yes. So you have to be in your license has to be in good standing and active. You have to have one of the required certifications, either through the ANP or the ANCC. You have to have at least a 3.0 from your master's program. And we require 2 letters of recommendation and a 500-word essay, basically describing why you're passionate about dermatology or how you feel this program is going to help you. And yeah.
Know the signs of a stroke, because the faster you act, the more of the brain you save. Use the word fast. F for face. Ask the person to smile. Is one side drooping? A for arms. Ask them to raise both arms. Does one drift down? S, speech. Ask them to repeat a simple phrase. Is their speech slurred or strange? T, time. If you see any of these signs, call 911 immediately. Do not drive yourself. Do not wait to see if it gets better. Time is brain. Every minute counts. Other signs of stroke include a sudden severe headache with no known cause, sudden vision changes in one or both eyes, sudden confusion, and sudden loss of balance or coordination. Stroke can happen at any age. Black Americans experience stroke at nearly twice the rate of white Americans and are more likely to die from it. Know the signs, share them with your family, put FAST in your phone right now so you never have to remember it in an emergency. If you or someone near you is showing signs of a stroke, call 911. Not in 5 minutes, but now. This message is brought to you by the Melanin Initiative podcast, where we simplify health information so you can advocate for yourself and the people you love. Find us on Apple and Spotify.
Okay. And let's see, who makes an ideal candidate?
So an ideal candidate is someone that either works in either primary care or I'd say primary care or already in dermatology. Maybe they only have 2 to 3 years of experience and they are interested in building their foundation in dermatology, either to switch into dermatology or if you already work in dermatology, to strengthen your base knowledge and skills and eventually pass the DCNP board exam. And then within the primary care setting, someone that, again, either wants to switch into dermatology or just wants to start incorporating more dermatology care into their primary care practice.
And so, okay, so we do know dermatology is quite popular these days. And we have people from all kind of specialties wanting to come over. So if they're not like Jordan with a primary care background, what can they do to kind of bridge that gap?
So it depends on what specialty they work in. But I like to tell people that never underestimate the experiences that they have and to really, like I've coached people on this, look at what they do from the day to day and try to find the pieces that are connected to dermatology. So if it's gastroenterology, oh, do you have anyone with, do you see patients with Crohn's or ulcerative colitis? Are they on, iziquimab or other medications that can be for both psoriasis and ulcerative colitis? So kind of trying to find the connections. Do you ever ask them whether they have psoriasis, or do you look at people's skin? If they're in endocrinology, acanthosis nigricans, just sort of looking for ways to connect what they're doing in their current practice with dermatology.
Very good advice. For Jordan in particular, I think you did a really good job kind of laying out what the weeks can look like, right? As you're planning your whole life around having a full-time life, a family, working full-time still, and also being enrolled in the program. So for Jordan in particular, how can he prepare for success, knowing kind of the demands and the requirements?
So Jordan could prepare by getting the textbooks and having them at work. If he ever has downtime, just going through the chapters. For each module, we also do have recommended readings, and we also utilize the SIM videos. So, and the American Academy of Dermatology has a really great library of resources as well that we also cite in our modules for students to go check out. But having the books just handy, so if there's ever any downtime, just reading through it and trying as hard as you can to be present during class, because we want everyone to be successful. And it's apparent when people care about their own success as well. So if people are doing their best and really trying, and they'll be successful in the program.
Wonderful. You did touch on cost a little bit. Do people use loans? Are they paying out of pocket? You know anything about that?
So I've never directly asked anyone, but it sounds like most people usually just directly pay.
And then You said something I was going to ask. It'll come back to me. Does the program incorporate technology like decision support software or teledermatology?
So that's a great question because it actually just hit me how awesome it is that all the students that are enrolled do receive an FAU email address, and we use the Microsoft like Teams and Outlook and all that.
Mhm.
And so they'll have this Outlook email, but that's also connected to the Word, Excel. So by having access to their email suite, they get access to basically the entire Microsoft suite. So there's that, and they're able to utilize the Zoom because that's what we use. And you asked about telehealth.
Mhm.
We don't provide any resources for telehealth.
Or, I mean, like, is it covered in the program? Like, how to get a good visit, quality of imaging,
Oh, I
give
see. Okay.
information?
That's a great question. And honestly, since it's Mary and I, we are definitely going to put that into, like, build that into the curriculum. So thank you for bringing that up.
Mhm.
You know, we do have a talk on AI and dermatology, and we're going to be bringing in individuals that are basically founders of an AI company that's a clinical AI.
Mhm.
And we did actually used to partner with Visual DX, and I
Mhm.
wonder if they may want to partner again
Mhm.
now that it's Mary and I, and it's really getting some good traction. So yeah, so far as technology, we have the talk on AI and possibly demonstration, and but the telehealth though, that's a really great topic. So thank you.
Yeah. The person you have in mind for the AI, is it Derm Engine?
It is not
Ah, do you know them?
the one that we are gonna
No,
that we're
are you familiar with Derm
oh,
Engine?
Dimension. I'm not familiar with them.
No, I'll introduce you. Yeah, they have a really great platform. Yeah, and I
Oh,
think
okay,
it's good
cool.
for your students to be exposed to these opportunities that exist.
Definitely.
Any other
Yeah.
AI stuff? I mean, there's so much AI in dermatology right now.
hmm so something that we do cover is just preparing our providers for when our patients come in
Mhm.
after utilizing AI, and just how to approach those topics, and be open to what our patients are sharing with us and guiding them in the right direction. Um, and then also now there's like new devices coming out, but I personally feel like it's going to be one of those things where we wait and see what stands out in the technology before we introduce things to the students.
That are already using it.
The
They're already,
students.
yeah, they're already using it, right? So the patients are using it, and we know our providers are using it. They're talking about this every day in the group chat. And
Mhm.
so a lot of the education is always focused on the patient and not necessarily also telling that provider how they can utilize it so that they can eat dinner at night at the table with their loved ones.
Mhm.
Those kind of things. And so I know a lot of companies are now incorporating it. Providers are doing it on their own too, but a lot of companies are also incorporating AI to help make documentation a little bit smoother.
Yes. Oh, for charting. Yeah. Sorry, I was referring to devices, like the AI devices, like the Derma sensor and
Mhm. Yeah, yeah.
yeah. But yes, definitely the charting AIs. Those are amazing, but a little scary as well. But that's a different topic. But very beneficial as far as getting charting done.
Yeah, and you mentioned some abbreviations, and so since we're a health literacy podcast, we always try to address things for the audience so that they know. You mentioned AAMP, and so for our audience and especially our clinicians who are watching this because they're interested in applying to your program,
Mhm.
or they're still in nursing school and they're not really familiar with this yet. AAMP stands for the American Association of Nurse Practitioners, and our other board certifying group is the American Nurses Credentialing Center. I'm ANCC certified. And both of these organizations support us in our ongoing education, help maintain a level of regulation, making sure that we understand our scope of practice and maintain that level of standard of care. And so when you're getting your continuing education credits, you're going to them to see what is needed to maintain your certification.
Mhm.
And so I want to mention that. Okay, so let's look at their clinical skills and what they can learn. So you talked a little bit about dermoscopy and dermatopathology. You kind of mentioned it anyway. Can we just talk about how much exposure the students will get in their curriculum?
So exposure. like how many classes or?
Just like education, if someone's coming from primary care, these words are new to them. They've never even heard them. And we know
Mhm.
that they're going to be expected to understand what that is when they show up. And so these series of questions are just things like how well prepared will they be when they show up in clinic?
I think so. They'll be extremely comfortable. I will say that on the job experience is the most valuable, and that's why we used to require the clinical hours, but we also understand how difficult that is. But with regards, we'll say specifically dermoscopy. We will have two different courses on it, and we'll have it in the hands-on skills workshop. We'll introduce the devices, the like how they work, what the different settings are, using them wet or dry, and also what we're looking for, looking at benign lesions, also non-melanoma skin cancer, also melanoma, trichoscopy. So trichoscopy is when you're utilizing dermoscopy to assess the hair follicles and the scalp or anywhere else on the body, but specifically looking at the hair. Um, and then we do have the last portion. So further in the program, the more advanced dermoscopy course. So just sort of diving a little deeper into it. And
Wonderful.
yep. And so for the derm path, I think we'll do the same thing for dermatopathology. So that is dealing more with what we're looking at when we do biopsies, what the dermatopathologists are looking at. It's important for dermatology nurse practitioners and providers to also have an understanding of what they're trying to capture when they do biopsies so that they know how to do them properly, where to take them from, for what specific condition, and then that way the dermatopathologist is getting what they need to make their best assessments of what they're receiving.
Wonderful. Any lectures on how the role of farm reps and how to navigate those relationships?
So we don't have a specific lecture on that, but that's actually another really great topic to include in our professional growth part, which is towards the end of the I'll say the end of the year, um, because that is a very, very important subject. There was actually a journal article that I used to keep with me to share with like any new medical assistant, or actually no, it was, did I share it with medical assistants too? But I would give it to any new provider that started at my former practice and be like, you should read this. You need to read this because it's just really interesting and important to know just the, it's important to stay non-biased. I'll say
Hmm.
that.
Okay.
Mhm.
And medical science liaisons, another role that's quite new to people not in derm.
So, do we talk about medical science liaison?
Yeah, so a lot of the curriculum always focuses on the patient care. If
Mhm,
you actually show up in real life, there's all these other things that we're encountering
mhm,
for the first time, and there's no manual, there's no guidance, but
mhm.
questions, there's opportunities, there's
Right.
conversations. And so, unless you do have a mentor like yourself,
Mhm.
you're kind of navigating that on your own. But additionally, NPs and PAs don't know that those are opportunities in terms when they're ready to advance their career outside of direct patient care.
Absolutely. That's a great point because I was thinking they are fabulous resources,
Mhm.
but that is really important for them to know that eventually, after they've really developed their dermatology career, working in dermatology, that is an option for them as well, a professional opportunity. I so we are actually having a medical science liaison be one of our guest speakers to utilize our resources, and she's a pharmacist, which is perfect for the topic that she'll be covering.
Mhm.
And yeah, so that's going to be a really wonderful teaching opportunity to let the students know, hey, this is a medical science liaison. You don't know what that is. This is what they do. They're supposed to be non-biased. They don't talk about the actual drug. It's all disease state, the pharmacology behind the different drugs, etc. So we'll make sure that we kind of throw that in there too.
Mhm. Any advice for Jordan when it comes to those two relationships, the MSL as a resource and as well as the pharma rep?
So for Jordan, I would say if he ever has any questions about prescribing it or any hesitations with a certain patient due to their clinical presentation, those are great questions for the medical science liaison. With regards to the rep, if they need samples or Also, access questions, which now a lot of the companies have the field access specialists, or they'll have different words for them or different titles, but it's basically the person that you can share the patient information with, and they will go into the system and look for their prescription and see what's going on with the insurance or with the pharmacy, and just help with bridging that gap between when you prescribe, and it's usually like the biologics or any like a specialty medication, from when you prescribe it to it actually getting to your patient. So those are also wonderful resources, which the rep is usually the one that connects you with them. And talk to the reps because they're very helpful. You know, they're our partners at the end of the day. They're there to represent and give information about the medications. They're the ones that usually have the flyers for you, or they have different flyers from what the MSLs will have, and they'll sometimes have copies of studies that will cite they'll have the actual data that they're citing when they talk to you. So they are also a wealth of knowledge, but the medical science liaisons will just be the more non-biased source.
Okay, wonderful. And we'll invite one of them on so that we can also dedicate a whole show to them too, because I think what they do is pretty fascinating. I know, well, at least from my understanding, traditionally it was mostly PharmD or pharmacists that fulfilled that role. But over the course of time, we've seen some doctorally prepared nurse practitioners in there. And I think I've heard that there's a doctorally prepared PA that's
Yes.
in that role. And so
Mhm.
it's always nice to see the evolution of our value when it
Yeah.
comes to medicine being recognized and compensated.
Yes, definitely. And the last role that I think is worth mentioning as well to our listeners is the thought leader liaison,
Mm-hmm.
which I believe has different titles as well based on the company, but
I was going to ask you about that one.
yeah. So the thought leader liaison is basically the connector of people within that company. So their job is to just kind of know who is like talking about what and leading what initiatives in the dermatology space. So they like to connect, also another term, KOL, which is key opinion leader within the dermatology space. So, for example, if you wanted to meet the head of the diversity in dermatology conference, you talk to your TLL, hey, I'd like to meet this person, and she'll say, yeah, I know them, and then they'll get an introduction for you going, and yeah, they're also a wonderful contact to have, wonderful resource.
Yeah. We know that looking at the resource that you're looking at, there's over 3 or 4,000 diagnoses in dermatology. So right there, there's a lot to learn. But even just now in the last 5 minutes, we've gone down a list of other vocabulary words where it's like
Mhm.
just on the professional side is also a lot to learn. But also that comes with opportunities, right? Because those are being served by people just like you and me, other
Mhm.
PAs. That because I've also heard someone call the APP liaison, and you
Yeah.
said they're just different titles at different companies, right?
Mhm.
So,
Yep.
so Jordan's brand new, but someone who might be experienced when they're listening to this, and they've only really focused on the clinical side, taking care of the patient, and they're not really well versed in these other opportunities. Because you had mentioned once you get enough experience. So for that person listening who has been practicing in derm for a little while and they're thinking they might want to transition to something different, what do you consider? Because everyone asks this every day. What do you consider is adequate experience to transition into those sort of roles?
Adequate experience. I mean, I think that depends on the role. So I guess, for example, MSL, my first thought that comes up is first is look at the actual job posting, because that might just tell you right there you need 7 years of experience in dermatology. So maybe at 5 you feel well prepared, but it might take 7 to actually be able to apply, um, unless unless you know someone in the company. I don't know, but which is important. That's why networking is so important. But I would say just, and you can also, speaking for industry is another great opportunity. And roles like that, it if you're passionate about dermatology, like, and you really dive in, you do a program, you do a residency, and you're just really passionate about it, and you get well known among industry. I don't see why someone with 4 or 5 years of experience couldn't start dipping into that world of speaking for industry. And that's a great way to just get well known in industry before getting a job as an MSL. Because if I'm not sure about this, but I feel like MSL is kind of another level from being a speaker. So, because yeah, the speaker role is more 1099, which means it's a contract. It's contract based. So you get signed up for different dinners here and there or different conferences. Whereas the MSL, that is your job. That's a W-2 job.
Thank you. I love that you added those other information. That other information is very important, especially because my next question is,
Mhm.
so we'll all kind of mention some things you can say, yes, we talk about, no, we don't talk about in the program.
Mhm.
Financial literacy is one of the questions that I have to see if it's being brought up at all.
Personal financial literacy.
Yeah. Hmm. Yeah,
We
as a
do.
provider, right, managing
Mhm.
finances, to make you can make some good money, right?
Mhm.
And we know we're not learning about how to manage that at home or in P school.
Mhm.
Um, is that being touched on at all?
It's not.
Okay. Contract negotiation.
Yes, in our professional development at the end of the year. Mhm.
Great. Productivity-based incentives.
No, that's a good topic, though. Let me write that down.
Yeah. Uh-huh. Billing or coding.
So yes, billing and coding. And now that I'm thinking back on our last billing and coding, I believe she mentioned it, just how it gets incorporated into when you're trying to ask for a raise or what have you. She did mention that. So it does get touched on in billing and coding, but there's no deep dive
Mhm.
specifically about the production.
Practice management.
No.
Publishing.
Yes, big time.
And we've already talked about those. And so I think you've done a really good job of letting Jordan know what the workload looks like. Oh, what can he expect to walk away with? Clinical competency, certifications, hours.
So he will walk away with a total of 120 CE units.
That's impressive.
And then if he was able to get clinical hours on his own,
Mhm.
that's up to him. He would log it himself. That goes towards the 3,000 required hours for registering for the DCNP exam. And he would also walk away with 20 to 25 other new friends in dermatology, a wider network. He would also walk away with about 20, well, maybe like 10 to 15 email addresses and contacts of other wonderful, notable PAs and NPs in dermatology. So, again, widening his network in the world of dermatology and, yeah, just some new foundational knowledge and skills in derm.
And there are some in-person hands-on opportunities, right? Can you just talk about how often that is and it's mandatory, what that looks like?
Yes. So the first semester we have the intensive weekend basically. So it's a Saturday and Sunday, and it can vary between being a Friday and Saturday, or Saturday and Sunday. It's a day and a half, and basically we do some hands-on procedure skills. So I did mention before the one for essentials is shave biopsies, biopsies, IND, which is incision and drainage, suturing, different suturing techniques. We may do light therapy for this first semester. We're going to do dermoscopy, um, and also cryotherapy and so that's the first semester. That's during essentials. And also I did want to mention, when you asked about how much it costs for the 2 semesters that have the skills workshop, there's an additional $175 fee. So I want to mention that. So for the first semester, it's 4,175. And so it is a requirement to attend the intensives. If the person absolutely can't make it to even one day, then it'll be excused and we'll Zoom it. We'll have the Zoom set up for them, because this did happen during my first time hosting the skills workshop last semester. So we had the Zoom open for them, but we highly, highly encourage everyone to physically be there, because it's such a wonderful opportunity for hands on learning. The final semester, we had Candela come in. They brought 2 of their devices with the different attachments, because like the one device will have different lasers on it. And we were all able to practice different lasers and procedures on each other. We did microneedling on Mary and on Dr. Bolfin. They were our models while I demonstrated and kind of walked through it with every single student. And we had a local nurse practitioner come in and talk about wound care. And then everyone got to practice putting on an Una boot onto each other. So it was really fun. And I believe Sun Pharma provided lunch. So yeah, it was a fun day. They're fun days, and you get to meet the students. And it was funny. It was Mary and my first time doing it since we started working together, and the students were very friendly with each other. And they're like, "Oh, hey, how's it going?" And we're like, that's really interesting. They're all so friendly. And then we remembered, oh, that's right, we weren't there for the first skills workshop. So everyone got to meet each other during the first skills workshop. We were kind of the new people, so we got to meet everybody for the first time. It's a it's a really it's a good time.
And people usually just book a hotel and it's in
Mhm.
walking distance, or they Uber. Do they bring their family?
So I'm trying to think. A couple of the students last year did bring their families and made a weekend of it. And there's a local Wyndham hotel that's nearby that they'll sometimes give FAU students a special deal. But also, though, for that particular semester, it was right before the CDNPPA conference. So we set it up so it was 2 days in the middle of the week, and then the conference was right after. So people kind of booked at the same hotel that was reserved for the conference, and then they just stayed through basically the whole 4 days.
That's wonderful. What part of Florida?
Boca Raton.
Oh, okay.
Yep.
And you mentioned a little bit of cosmetics. How much cosmetics is covered in the program?
So it's mostly medical dermatology, but we do have it's during the hands-on workshop. Actually, during the skills workshop, we do cover basics of Botox, but and filler and the different types of filler, and then the microneedling and the lasers. But we don't dive in too much into it. It's mostly medical.
And on those hands-on, it sounds like there's a little bit of lecture and then some hands-on also.
Mhm. Yep.
And this is at Florida. This is at the campus, right?
Yep.
Okay. And then where do graduates usually go after they're done with the program? Kind of like your success rates.
So as far as where they go, most of them kind of go back to where they were working and then go from there as far as looking for a dermatology job or whatever they want to work on. But the students that we've reached out to find out about specifically the dermatology certification exam, everyone so far, which not everyone has responded to our emails, but everyone so far has passed, that has tried to take it, has
Mhm.
passed. It is not a requirement for the program to take the exam, but it's highly encouraged.
Mhm.
Mhm.
And then any skin of color, and to what degree is it covered in the program?
So, yes, we do try to make all of our presentations as diverse as possible. And as I mentioned earlier, we had a contract with Visual DX, but either way, we do encourage our students to use diverse resources for looking and reading about skin conditions. And Visual DX just has a really great library of different conditions on all different Fitzpatrick skin types, but then also all different body parts. And yeah, it's a good resource for that.
Excellent resource. They have a website as well as an app. They have over 45,000 diverse images on skin, the largest visual library of everyone. And yeah, I'm sure they would love to renew that contract with you guys. Now, you said you encourage them to look at diverse resources. Do you have like a list or recommendations, or they just you send them to Google?
So in each module, we have our suggested reading or like different actual like journal articles about what the topic is for that week. And then the required textbooks are the Wolverton textbook, which I have the name of it, Comprehensive Dermatologic Drug Therapy, and I think they're on the fourth edition. And then a textbook that Dr. Margaret Babanich also co-authored, but
One of my favorites, by the way.
the Dermatology for Advanced Practice Clinicians,
Mhm.
and then Habib's Clinical Dermatology, a color guide to diagnosis and therapy. That was one of my favorites back in the day. I loved Habib. because my boss had told me to get Andrews.
Mm-hmm.
It was literally every single diagnosis that you would ever see in your entire, like, that ever existed on the planet, and it was very overwhelming.
Mm-hmm.
And then Habib's, and yeah, the dermatology for APPs
Mm-hmm.
is also really good. Just it really breaks it down and makes it easy to swallow.
Yeah, it's my most recommended for NPs because, I mean, it was written by an NP, but I think it most resembles a lot of the other language that nurses and nurse practitioners have already been exposed to. And so that is why, yeah, because some of those other ones are a little bit intense. And I think that it covers the way that we are taught to approach care. And so that's why
Mm.
recommendations. At the Mahogany Dermatology Nursing Bookstore, we actually have a list of what I consider the essential dermatology textbooks for skin of color. It includes over 10 books. There's way more. Some of my top two favorites were written by Dr. Susan Taylor, who is now the president of the American Academy of Dermatology. She has one on dermatology and skin of color, and then she also co-authored an atlas for skin of color. And so, yeah, and there's a whole bunch. There's Asian skin, pediatric skin,
Mhm.
long list of books over there. There still remains a paucity of data when it comes to pediatrics, cosmetics, and wound care on skin of color and dermatology. Even the books on that website that are listed on at the bookstore, as well as on the Skin of Color Society, we know textbooks when they come out, they're already almost 10 years old at the time of publication.
Mhm.
So the need is there. So people who are interested in writing and filling those gaps, another way to specialize in dermatology is to provide those resources. I've had the pleasure of meeting a medical certified illustrator. Even she had trouble when she was trying to learn how to add to, to improve this access to images of diverse skin because she couldn't find images. We
Wow.
just think about ourselves, but look at all the other people in our field, in our industry, who also are kind of have this same barrier in their own learning and in their own ways of trying to educate. And so, obviously, you already know that's a huge platform of mine. So,
Mhm.
yeah, thank you for addressing that. And then, as we wrap up here, two things from you. One,
Mhm.
what is an essential component all dermatology MP programs should include?
Let's see. So definitely assessment and diagnosis, specifically morphology of skin disease, and how to sort to break it down and narrow down your differential diagnoses. That should be essential.
Very important. And then, where do you foresee dermatology going over the next 5 years, and how can programs prepare NPs for that?
So, with the advent of all the new technology, I feel like it's going to become more and more of a partnership with our patients as far as them bringing us information. There's going to be newer and newer technology with being able to potentially screen for skin cancer without having to do biopsies. And I think we're just all going to need to stay as up to date as possible with what's out there and keep reading and keep learning so we're ready for what's coming and how we can leverage these resources.
So, speaking of that, you're married, you have your own business, now you're head of faculty, and you hear that advice, right? Keep doing this, keep doing that. How does someone manage that, like realistically? Because that's what we're faced with as a new provider, right? How do
Mhm.
I keep all these pieces going and also take care of myself and not get burnt out?
So I've heard everyone's different strategies.
Mhm.
I'm a nerd, so it's like easier for me to read
Yeah.
certain things, but just reading one journal article a day.
A day.
Yep, or like half of it in the morning or half at night, or at least a few pages.
Mm.
And now and like specifically with the JD and PPA, there are different like segments, like there'll be one pager, it's a case study.
Mhm.
Even if it's just that you get through, that's still something and you can still glean information from it. So just getting through one piece or a few pages a day.
Mhm.
And now also with you have to be careful with AI though, because sometimes you can even summarize something using AI or
Yeah.
help AI to break something down for you when it's a little too technical,
Yeah.
especially in the journal of the AAD, the Journal of the American Academy of Dermatology. Their articles can be a little bit heavy. So sometimes you can utilize AI to break things down or to summarize, because like I like your reaction of like a whole article when
Well, it's easy for me, but I
but
love.
not everyone has that time. Yeah, and especially if you really want to understand it. Because I
Mhm.
know for me personally, and that's why I mentioned AI with summarizing or just getting like the meat from something. I'll have to read things again to make sure I understood it properly, or like just to make sure that I have it in my head and to remember what I'm reading. So yeah, I definitely get the time barrier, but even if it's just a few pages a day.
Yeah, I actually like that a lot. So, the Adobe Acrobat app, it has a read aloud feature. So that's how I consume a ton of
Oh,
content.
hmm.
I do spend quite a bit of time in the car commuting, but I always tell people when,
Yeah.
when your hands are busy, your ears
Mhm,
are free. Washing the dishes, walking the dog, vacuuming up the dog hair, commuting an hour here in Texas.
mhm.
And so I just, especially because I train a lot of new MPs or new
Yeah.
to the specialty that we're in. And I was like, in the morning, you're excited, your brain is full, it's a sponge, it's ready to absorb. By the end of this day, your brain is full. You don't want to learn anything. So take advantage of the morning when you're, and that's easy because I don't have children. Sometimes the morning's already been interrupted.
Mhm.
So, just have to take a look at that. So the Acrobat Adobe app is a great one.
Yeah.
We have so
That's
many of our friends out here in the derm space that are doing podcasts just like this, and they're breaking down the latest evidence. And so, yeah, we want you to stay up to date. We don't want you to feel too overwhelmed with it. And you can get it from different ways that might be more appealing for you, so you don't get overwhelmed, and so you can take it in and be able to utilize it.
Yeah, thank you for sharing that, because is that an app on your phone? Because I
Yes.
haven't heard.
Yeah, and it's free, and you can,
Awesome.
and they also Adobe even has one for like scanning. But yeah, it's the
Mhm.
little three dots in the top, read aloud, boom. And
Okay.
it has the summary feature. So yeah, we do have to be cautious about AI
Mhm.
when it has access to the whole internet. But when you have like an app like that, it's only
Mhm.
using that information. And so there are
Mm.
some AI tools that are called LLMs, large language models. It only utilizes the information that you're giving it. Now you can use something like a chat GPT or and tell it, don't use other
Mhm.
resources, but there's still a chance it might. And so you
Mhm.
can ask it to hallucinate. But to avoid all those extra prompts, go
Yes.
to a large language model. That's the only information it's going to use. And so those are my favorites when I'm particularly looking at the data, because as much as I love AI, the greatest errors I've seen is when it comes to medical and science information. And so
Mhm.
there's still a lot of places to go there. And so while we are being encouraged to help our patients use it safely, I want to encourage all of us to be on the operator side. Shout
Mhm.
out to our PA friend, Timothy August, who is over there
Mhm.
doing some amazing work with
Mhm.
Derm Biller AI. He just came out with Analyze. I don't want to say all the ones because I don't remember all the names, but he is the one. He's out there. So, and I loved him because he's creating, but he's
Mhm.
not really into the business side. And so I tell people
Mhm.
sometimes there's so many ways to be in dermatology,
Yes.
right?
Yes.
Maybe
Yeah.
you're not into creating things, but I love to tell you how you, just like the MSL is going to tell you how to utilize that medication in a really quick minute so you can go use it and understand it and feel confident when you're telling your patient. I like to tell you how, as a provider, all these tools are available to you to
Mhm.
be efficient, proficient, and confident. So you have someone, a creator like Tim, and then I come in the middle and I can be that medical science liaison as on the business side. How do you maintain your financials? How to use this AI safely? How can you go home at night and eat dinner with your family every night?
Mhm.
It's a
I
really,
love that. Yeah. I will keep that in mind,
that's a
Dr.
big deal. Well, how can listeners connect with you?
So I can share my email address with everyone. It is Patricia, M as in Mary, Delgado at gmail.com. And I'm also on LinkedIn, so connect. I'm on Facebook. I actually have two accounts on Facebook because of social media and marketing and whatnot. But yeah, I'm happy to connect with everyone. I'm on Instagram as well. My practice is Sunrise Skin and Wellness. My nonprofit organization that holds the annual conference is Sunrise NPPA Derm. And I do also have a personal, which was also like my coaching Instagram, which is, I believe it's patricia.dcnp.
Yes, huge pioneer in this space, well known. The fact that you're even gracing this screen is lots of respect, lots of appreciation. well known in this space. You've carved out a beautiful lane for yourself. You've helped so many people. And you also wear very many hats. Yes, the entrepreneur, the researcher, the educator. And so you represent a lot just by being on this screen. Even your rich background as a woman of color, too, does not go unnoticed. And so we thank you so much. Not only do we thank you for sharing this information, answering questions that are asked every single day from people trying to get into dermatology, but I personally thank you for your support and your friendship for the years that I've been in dermatology. And I just thank you for that. And it's like 2 years anniversary for you, right, with the conference? Maybe
So
three. Is it three?
3.
Yes.
Mhm.
Okay. Yeah. Because I came to the second one. So yeah, this is 3. So yeah, congratulations to you. It is a
Thank
lot of
you.
work just doing that alone. And we've already talked about all the other things that you're doing, and those are all they're all successful, right? You've been able to grow your business, grow your team, which is a beautiful
Yeah.
transition.
I'm so thankful for my board. Oh my goodness. And thank you for your support, Dr. Madison.
Yeah.
You are an inspiration. I think I've told you that before, but I'll say it again and I'll keep saying it. You are truly an inspiration.
Well, thank you. You're doing the same. Remember, everyone, you can email us your questions and show ideas to tmi.melon@gmail.com. If you haven't already, you can still subscribe, leave us a comment or two, give us 5 stars on Apple and Spotify. When you interact with our platform like that, it lets the algorithm know that this information is important. So when people just like you look for information just like this, we'll show up higher in the search results. At the time of this recording, we release new videos every Sunday at noon Eastern on YouTube and LinkedIn. We're on every single social media platform and all your favorite podcast apps, which we drop the audio at 5 a.m. on Sunday. So our night shift friends can be the first to get something and not the last. We thank you all for watching. We'll see you next time.